مساء الخير دكاترتنا. انا ليا الشرف احضر مؤتمر وسط اساتذتنا من الجينيكولوجي والدرماتولوجي. اعرفكم بنفسي، انا دكتور هبه جلال فيزيوثيرابيست، وزميلي دكتور احمد اشرف.
مساء الخير على حضراتكم. طبعا احنا لنا الشرف ان احنا نكون مع حضراتكم النهارده في وسط اساتذتنا من الجلديه والنساء. النهارده المحاضره بتاعتنا عباره عن جزئين. الدكتوره هبه هتتكلم معاكم في الجزء الاول من المحاضره، وان شاء الله انا هكمل معاكم الجزء الثاني. اتفضلي.
Physiologic changes in a woman's life زي childbirth, weight fluctuations, hormonal changes due to aging and menopause. طبعا بنشوف loose skin near and around the vaginal region, laxity of the vaginal canal, weakness of the pelvic floor muscles. These events often lead to the development of genitourinary conditions: stress urinary incontinence, vaginal atrophy, dryness, vaginal laxity syndrome, physiologic distress, which affects women's quality of life, self-confidence, and sexuality. Our review aims to present the available technologies offering vaginal rejuvenation and incontinence treatment, starting from laser, DQRF, HIFU, and HIFM treatment, and the Kegel exercises. These devices and techniques open up a new market for non-surgical vulvovaginal and genitourinary conditions. It can be performed by a wider range of practitioners, including dermatologists, gynecologists, and physiotherapists. Okay, we started 1970 with general surgery, 2012 with lasers, 2015 with RF, up to HIFU starting from 2016, and HIFM starting from the last year. HIFM is high intensity focused electromagnetic field. We are gonna show it later. The HIFU vaginal machine, vaginal tightening system, uses a non-invasive ultrasonic focusing technique to focus on the mucous membrane, fibrous layer, and muscle layer directly. We use it to treat urinary incontinence, metrorrhosis, vaginal dryness, dyspareunia, menopausal symptoms. Okay, those parameters are generally used. The HIFU equipment includes the depth of 3 mm and 4.5 mm vaginal transducer, up to 0 to 30 to 360 degrees, angle from 3 to 20 degrees, focal treatment length 5 to 25 mm, pitch of 1 to 5 mm, output power up to 2 joules. Vaginal tightening heads, mainly cartilage 4.5 بنستخدمها للسماس layer superficial muscular aponeurotic system، وللي استخدم جهاز الهايفو فور فيس اند نيك ده نفس الفانكشن بتاعها بالظبط، برضو muscle stimulation او muscle toning، وده بيمبروف الماسل structure from deep to shallow. Cartilage 3 او transducer 3 is used mainly to activate the dermal layers of collagen. It enhances the effect of the outline, but also shrink the large pores and reduce the appearances of wrinkles. Okay, الفيديو ده هيوضح لحضراتكم ازاي نقدر نستخدم الهايفو علشان نعالج المشاكل دي. ده الهايفو emitting place والدبث بيبقى متحدد. لازم يبقى فيه 360 degrees rotation. دي cartilage 3، cartilage 4.5 for muscle stimulation، والانجل بتتحدد من تحت.
شغل الصوت.
اوكي.
اتكلمي بالعربي.
high intensity focused ultrasound focal زي ما حضراتكم شايفين. في insertion لازم يكون فيه 3 sections. A section ولازم يبقى 360 degrees. B section و C section. الهايفو treatment is time consuming kind of بالنسبة لبقية التريتمنتس. بنوصل ل 60 degree Celsius heat energy to stimulate الكولاجين او نزود الماسل تونينج بتاع السماس لاير. اوكي. احنا عايزين نبعته. هنا هقدم لحضراتكم specific protocols لمشاكل معينة. For example الستريس urinary incontinence او الفاجينال hyperlaxity. لازم التريتمنت تبتدي بكارتلج 3 وبالنسبه لكارتلج 4.5 بنغير البارامترز according للتارجت اللي احنا عايزين نحققه. يعني مثلا في الاس يو اي احنا بنستخدم rotation of 40 degrees round every 3 degrees angles avoiding the suburethral area and completing on each side 13 treatment lines with a length of 20 mm and a pitch of 1 mm, a total energy output of 2 joules to each focal point. Patients with vaginal hyperlaxity receive the same treatment with different parameters of cartilage 4.5. 340 degrees round, 6 degrees angle, 25 mm length, 1 mm pitch, and energy output to 2 joules. The A section, B section, and C section the same. Hypho emitting place والدكت graduation هنقدر نحدد احنا في انهي section بعد المكان بتاع الايميتنج بتاع الهاي انتنسيف فوكس الترا ساوند. والانجل for the last. Okay, my favorite part الهاي intensity focused electromagnetic field. على حد علمي ان الجهاز ده لغايه دلوقتي لسه ما نزلش مصر بس هو مستخدم وايدلي ويعني الفيدباك بتاعه بوزيتيف اكتر من اي جهاز تاني. It's a revolutionary treatment, can treat incontinence by strengthening and tighten the pelvic floor muscles. It can be used for vaginal rejuvenation to help improve the tightness and sensation of the vagina and give confidence back in sex life. As we age, the muscles in our pelvic floor often naturally become weaker. It can be due to the strain of vaginal birth or the drop in estrogen and collagen production as we had the menopause. This can lead to leaks, dribbles, and other symptoms of stress incontinence. Also, the increase of vaginal laxity and a loss of elasticity in the vagina. The HIFM causes deep pelvic floor muscles stimulation and restoration of the neuromuscular control. It's a non-surgical, non-invasive treatment for stress urinary incontinence. The vaginal walls are tightened as well. Incontinence is decreased. Okay, this is the main point. We can do 11,200 times contractures in a 23-minute session. The treatment is non-invasive. This is why the HIFM is different. It's non-invasive, no handpiece, no prop. It needs to be inserted. Patients simply sit fully clothed on the chair for about 30 minutes per treatment session. We are going to undergo 6 treatments scheduled twice per week.
I think this is the device that Dr. Hassan was telling us about. I think it's the same.
Yes, it's the same.
Yeah, so it's in Egypt now.
Good for us. Okay. electromagnetic field causing contractions. The patient doesn't feel pain, only tingling sensation. Conclusion. The HIFM technology aims to stimulate collagen, new vascularization, regeneration, contraction of elastin fibers, improve vaginal lubrication, and stress urinary incontinence treatment. My second favorite part, the Kegel exercises. This is the home protocol we can offer to our patients. There are 4 best positions to do. The duration is 6 minutes. Okay, the first position is lying on your back, side lying, lying prone on your stomach, sitting upright on an exercise ball or on a chair. Practicing.
Dr. Heba, we have to wrap it up. We still have Dr. Ahmed.
Okay.
Okay. Okay, the picture is perfect to illustrate what I want to see. She's sitting upright, and this could be continued for like 6 minutes daily, 3 times or 4 times per day. Thanks.